Good morning, everyone. To the LACNet's Patient Education Conference for 2018. First up, we would like to introduce Johnese Spisso, who is the CEO of the UCLA Hospital System and Associate Vice Chancellor of UCLA Health Sciences. We're really excited to have Ms. Spisso here because we'd like everyone to know about neuroendocrine cancer and see our wonderful group, and also because it's so great to be at UCLA and have their support. So please welcome Ms. Spisso.
Thank you. Well, it's my pleasure and privilege to be here to welcome all of you today to the Los Angeles Carcinoid Neuroendocrine Tumor Society meeting. And it's just wonderful that this society was founded in 2012 by a patient. And hearing and sitting through this morning, it was great to hear the questions asked by patients, because as healthcare providers, I really think it's important that we look at things through the lens that patients and families see the care and really work to put together systems and services that support the needs of patients and their families. The care of patients with neuroendocrine cancer really requires a dedicated and highly skilled multidisciplinary team, and we're really pleased to support that work at UCLA Health. We're working with our physicians, our nurses, and other healthcare professionals to continue to expand support services for state-of-the-art care and treatment, and it's great that we get all of your ideas and input on what we need to do differently and better to really meet those needs. Leading-edge research and neuroendocrine tumor centers of excellence from oncology, nuclear medicine, endocrinology, surgery, integrative medicine, and pain management services and theranostics are really important in this care of patients. Our talented and professional, passionate healthcare team members really care about the healing of patients, exemplified in our service standards. And it's really a pleasure to welcome all of you here today and really participate in this learning collaborative, where we hope to learn as much from our patients and families as we provide in information. So thank you so much.
Thank you very much, Ms. Spisso. I keep learning about even more programs available at UCLA, so it's great to be here. Next up, I'd like to invite up Dr. Donahue. And Dr. Donahue is Professor of Surgery and Molecular and Medical Pharmacology. He's the Chief of the Division of Surgical Oncology at UCLA and the Vice Chair of Surgical Cancer Care, David Geffen School of Medicine. Please welcome Dr. Donahue.
Thank you, Giovanna. Thank you, Johnese, for being here. I'm really here representing the Ahmanson Translational Imaging Division, which is led by Dr. Johannes Chernin over here. At most other places, it's called nuclear medicine, but we call it the Ahmanson Translational Imaging Division because we do nuclear medicine and we do so much more. The real goal of the division is to translate novel findings from the laboratory into patient care, to improve patient care. One of our main focuses is neuroendocrine tumors, both diagnostics and therapeutics for patients with neuroendocrine tumors. So this division really has been the pillar that's kept us on the leading edge of treatment and diagnosis for patients with neuroendocrine tumors, neuroendocrine cancers, and really that's been led by the efforts of Dr. Chernin, who has directed it. I'd also like to acknowledge Johnese Spisso, who's been very supportive of the division and of our theranostic treatments for patients, and we're in the initial discussion starting to plan a PRRT treatment center on the west side of Los Angeles. So we'll be able to administer that therapy in a dedicated center. Thank you to the support from Ms. Spisso. So you're going to see a lot of me today, but I just also wanted to acknowledge that it's been wonderful to work with LACNETS. It's really such an impressive society organization. Giovanna and Lisa, thank you, and this is a great day that's been planned largely because of your efforts. So looking forward to it, and thank you everyone for coming.